Cerebral palsy, CP, is a non-progressive neurological disorder of movement and posture. It causes limitation of activity due to a static lesion affecting the developing brain. Etiology: antenatal factors, affecting development of brain and is responsible for 70–80% cases. Intrapartum factor: asphyxia, exposure to maternal infections, chorioamnionitis, sepsis, urinary tract infections, temperature 38 during laboratories, prematurity. Postnatal factors: stroke, trauma, kernicterus from severe hyperbilirubinemia, central nervous system infection, congenital malformation of brain. Clinical features: delay in attaining motor developmental milestones, abnormal muscle tone and reflexes, peristent primitive reflexes like Moro's, ATNR, suck, rooting, etc., poor coordination, abnormal movements and postures, delay in speech, visual difficulties, intellectual disability, seizures, pseudobulbar palsy, and depressed gag reflex, leading on to frequent aspirations with feeding. Quadriplegia, 20%, most severe form of CP. It involves all the four extremities with generalized spasticity with mental retardation and seizures. Diplegia, 30%. Spasticity and weakness, predominantly involving the lower limbs with minimal level or no involvement of upper limbs. Hemiplegia, 25%. It involves either left or right side of the extremities. Upper limbs are more commonly affected at early stage than lower limbs. Monoplegia, triplegia, extrapyramidal, CP, chorioathetosis, dystonia, atonic CP, cerebellar CP, atonic diplegia, congenital cerebellar ataxia, mixed CP. History and physical examination with special reference to neurological and developmental status, MRL or CT of brain to localize the site of lesion or any congenital malformations, ophthalmic evaluation, hearing tests, ESPEC and language evaluation, psychological educational evaluation, EEG. Parent counseling should be taught about daily routine activities like dressing, bathing, eating, and follow-up by physiotherapist and occupational therapist. Drugs, muscle relaxants are used to relieve the spasticity, baclofen, dantrolene sodium, and benzodiazepines, hypertonia, strychnine, athetosis, chlordiazepoxide or levodopa, dystonia, carbamazepine, epilepsy, anticonvulsants.